Let's say it's one of those mornings where you wake up in bed and everything in your body hurts, head to toe, even your hair hurts, and you can't imagine how you're going to get out of bed, let alone do the chores and errands and tasks you need to do for the day. And all you want to do is really just to stay in bed and try to go back to sleep despite the pain. But there are a couple things that you can do while resting in bed that will help reduce the inflammation, reduce the flare, and manage your pain. And I'm going to show you how in this video, so follow along with this journey. Hi everyone, my name is Elaine Ouyang, and I am a certified yoga therapist. I bring you slow, nourishing, and chronic pain-friendly yoga so that you can learn to manage your symptoms and rise beyond their limitations. Now, before we get started, make sure you subscribe to my channel because I come out with weekly videos to help you manage your pain and your symptoms using these practical therapeutic yoga tools. Today I'm going to tell you a little bit more about how breath can be a powerful tool when you harness it correctly to help you manage your pain and your symptoms. When you think of breath, you think of something that you really aren't aware of, except you know that you're probably breathing right now because you're still alive. In the yoga traditions, it's believed that breath has the capability of really changing the physical functions of your body and your mind. Remember the last time you were angry or frustrated or anxious, your breath is probably a little bit more shallow and short up in the chest, almost like you're hyperventilating a little and your body is tense. So we know that what you're feeling emotionally in your mind can impact the way that your breath is responding. So the yogis have experienced that and observed that you can do vice versa. You can use your breath to physiologically impact the state of your nervous system. I'm going to show you 3 different breathing practices, and to start off, all you need to do is find a comfortable sitting position or lying in bed, whether that's on your back or on your side or whatever shape, way, or form that feels most comfortable for you. First off, as you are experiencing pain and inflammation and flares, you're probably thinking, gosh, not again, and I'm so sick of this, and I just want this to stop. Like, when is this going to stop? Why can't I just get a hold of what's happening in my body? So already your nervous system state is a little agitated. So we need to meet your body where it is. First breathing practice is actually going to help meet the level there in terms of its energy, and then we'll start to bring it down and calm it down. All you need to do is take 2 quick short inhales and 1 regular exhale. So like this. As you take your inhales, you're trying to kind of sip quick air into your body and into your belly, into your lungs, and then when you exhale, you expel it out through your nose. Let's get started here. 2 quick short inhales and 1 regular exhales. And then return to a normal, natural breathing. Take an easy breath in and an easy breath out. And notice how that made you feel. Okay, at first we might feel a little bit more agitated, but that breathing practice with the 2 quick short bursts of inhale and regular exhale should slightly start to bring your nervous system down a little. You may feel like you've cleared out some stuff, cleared out some of the anxiety and agitation. So not only is this great to do when you're having a flare, but it's also great when you're just feeling a little overwhelmed and anxious in your mind. This next one is called a humming breath. As the name implies, you're going to hum, but you're going to hum on your exhales through closed mouth. Your length of exhales, your length of humming will be different from mine, and your sound is going to be different from mine. So you don't need to try to match the sound or tone or length of my humming. On your own, all you need to do is just hum as loud as you can hear it yourself. So it's almost more like an internal sound and internal vibration for you. Let's go ahead and get started. We're gonna do about 8 rounds here. And again, you don't have to match my length, so we may start and stop at different times and lengths. Take a breath in through your nose and then hum on your exhale. Do one more. And once you are finished, you can just allow yourself to sit in the after effects of the humming practice. You may notice some reverberation and some lingering vibration from the hum. And all of this is really great to, again, dial down the nervous system state. And you may feel this in your body and your mind as well as you sit in the after effects of the humming breath. Let's move on to our third breathing practice, which is called alternate nostril breathing. Now, the alternate nostril breathing that we're going to do today will further kind of cultivate that same response. We can do it one of 2 ways here. The first way is to use your hand to place the thumb on your right nostril and your index finger on your left nostril, okay? And basically, you're going to use your fingers to direct the breath in through your left nostril and exhale through your right nostril. If you're really fatigued and really uncomfortable and just even bringing your arms up, bring your hand up to your nose is out of the question, or maybe you're lying on your back or on your side on your bed, then we can do what we call a non-digital, so no hand, alternate nostril breathing, where you imagine that you're breathing only in through your left nostril as you inhale and breathing out through your right nostril as you exhale. So go ahead and get yourself situated and comfortable. If you're using your hand, go ahead and place your thumb on your right nostril and your index finger on your left nostril. Okay, if you're not using your hand, just get comfortable here. Breathe in through both nostrils this first round, and breathe out through both nostrils. And then close your right nostril with your thumb. Inhale left, or imagine you're just breathing in through your left nostril if you're not using your hand. And then close your left nostril with your index finger. Exhale right. Good. And then close your right nostril with your thumb. Inhale left again. Close the left nostril with your index finger. Exhale right. Close your right nostril. In left. Close the left. Out right. In left. Close and out right. And keep going a few more times on your own. Now again, if you're not using your hands, then you just imagine that you're breathing in through your left and out through your right. 2 more going at the pace of your own breathing. And the next time that you exhale out through your right nostril, you're going to rest and return to a normal, natural breathing. I hope those 3 breathing practices have helped a little bit in slowing down the flare or reducing the flare and feeling a little cooler in your body, a little less inflamed. Now you can do these 3 breathing practices whenever you feel like there's a flare going to happen, so you kind of nip it in the bud, or as a daily preventative practice. The more you can practice these 3 breathing practices, the more you can keep the body in terms of being able to go back and forth between more the fight or flight, which is what we all need to get through the day, and the rest and digest, the relaxation response. And that's where the magic is, to be able to bring it back down when you need it, when you ask for it. That's when you have more control of your body. That's when you feel more empowered. And that's when really the healing can start to happen in that relaxation response. So let me know how that worked out for you. You can drop in the comments below or email me directly at elaineyogatherapy@gmail.com. Yeah, make sure that you subscribe because I'm going to come out with more practical tools next week on a short little sequence of how to manage chronic pain with yoga therapy movements. Thanks again for watching, and I will see you next time.